With the upcoming election this November, everybody is talking about the candidates, whether it's past or present candidates, and they're talking about their ideas and policies that they would want to implement if they were to become president. One of the most diverse topics I've seen talked about is Medicare for all. In the face of a global pandemic, we are debating whether or not we need a universal health care system, while 27.5 million Americans are uninsured right now. If 33 other developed countries have done this and are doing it for their citizens, why hasn't America done it yet? First, I will talk about the negative effects that nearly 10% of our country is facing right now. Then I'll discuss the economic side and how we will be able to afford this, and some of the financial benefits we will have if we implement universal health care. Finally, I'll talk about the health benefits of Medicare for all, even for those who can already afford it and don't really see a plus side in it for them. But for those who can't afford insurance right now, they live in fear that something could happen to them or a loved one, and they won't be able to pay those hospital bills. Anthony DeMarco says that 1 in 5 uninsured adults in 2018 went without medical care due to the cost. Most of these people are from low-income households where normally just one person might be working, or they're all living paycheck to paycheck. Samantha Ortega also says that this could be a racial issue. African Americans are 1.5 times less likely than white people to have health insurance. And for Hispanic people, it is 2.5 times less likely than white people. And then the main argument that politicians have against universal health care is that we just simply can't afford it. This is not true. We can afford it. It will actually save us money. Politicians just tend to say that for their own financial gain and to protect the 1% instead of the majority of the American people. One example that the government can pay for it is that the Federal Reserve in March dropped $1.5 trillion on the financial system because of the coronavirus. Jeff Spross wrote a whole article on it saying what exactly happened and why it happened. And then Diane Archer also wrote saying that 22 different studies say that having Medicare for all will be cheaper than what we are doing right now. It will reduce the administrative costs. The administrative savings will be up to $600 billion a year. That is 3/4 cheaper than what we're paying right now, with $812 billion a year. And then we will save between $200 and $300 billion a year on prescription drugs. We will have to increase taxes on corporations and on those with higher incomes, which is a big reason why people don't want universal health care. They don't want to have to pay more taxes because they make more. To any of these disadvantages, the benefits greatly outweigh them. No one will have to worry about paying ER bills or emergency doctor's visits for their children. Prescription medicine will be widely available and affordable. And then even if we go with Bernie Sanders' plan, which is seen on the extreme side, that will include dental care, vision care, and maternity care. Most pregnant women go without prenatal vitamins and all these doctor visits because they simply cannot afford it. In conclusion, this system is extremely important, especially right now during a global pandemic. 27.5 million people don't have coverage, which is scary enough, but is absolutely frightening right now for them. Thousands of lives will be saved along with billions of dollars every single year. Nearly everything medically will cost little to nothing. Politicians argue against it for their own financial gain and not in the interests of the American people. We have to catch up with the other 33 countries and switch to Medicare for all.